Hi, my name is Amanda Wilbur. I'm a registered nurse, and I'm going to school at Weber State University for my bachelor's degree. Um, for my community presentation, I have chose wheat flour inhalation and related health risks. Respiratory disease can occur from exposure when dust particles are inhaled in a worker's lungs. The process is most common during cleaning, milling, packaging, and loading of flour products. Occupational diseases, such as this one, are in response to a person's work environment. For flour mill workers like yourself, exposure to flour dust is associated with impairment of lung function. Short-term symptoms, acute shortness of breath, cough, chest tightness, wheezing, nasal and eye drainage. There's more. This is the most common that you'll see. Long-term health consequences, impairment of lung function. So hypersensitivity pneumonitis. This one is rare. It's a lung disease caused by the immune response to an inhaled antigen. This is caused by inflammation of lung tissue and can lead to scarring and long-term complications such as shortness of breath and exercise intolerance. The more common one that is seen frequently is occupational asthma. This one is both short-term and long-term. It's characterized by asthma symptoms that are present while the person is at work and the allergen is present, but once they go home, symptoms usually subside a little bit. Preventative measures. Wear PPE. Do not eat or drink in areas with exposure to dust. Wash hands frequently. Remove and change contaminated clothing when leaving the workplace. PPE, such as N95 and respirators, should not be the only means of filtration, but should be working in conjunction with mechanical ventilation that your facility should already have in place. Proper fit of PPE is important. I have this video that it's a short video on how to do a self-fit test, and it should be completed with each use of an N95, but only after a formal fit test has been completed by your facility. There's different sizes of N95s. I have a little bit of a smaller face. I wear a 1860 small. So when you go to do your fit test, they will decide which type, which shape is appropriate. Males will have a harder time and typically might need to use a different type of respirator instead of an N95 because hair length can alter their effectiveness. But females shouldn't have a problem as long as this little band and everything is fitting tightly. But let me show you this video.
Your N95 respirator only protects you if it fits properly. Before you wear it for the first time, your institution's designated fit tester will perform a fit test. After that, a user seal check must be performed each time you put on the N95 to check that it is donned correctly. You can check the seal of your N95 with a positive or negative pressure test. Always follow the manufacturer's user seal check instructions for the specific model of your N95, as not all N95s can be checked using both positive and negative pressure. If the N95 has an exhalation valve, the seal cannot be checked using positive pressure, and it could expose the patient to a virus if you are an asymptomatic carrier, so it is not recommended for use. To begin your user seal check, cover the surface of the N95 with your hands so air is prevented from passing through the facepiece filter. For a positive pressure seal check, gently exhale and feel if the facepiece bulges slightly. If you do not feel the facepiece bulge a little, the respirator may not fit properly. For a negative pressure seal check, cover as much of the facepiece filter with your hands as possible, quickly inhale, and feel if the facepiece collapses slightly. If the facepiece does not collapse, the respirator may not fit properly. During the positive and negative pressure tests, if you can feel air moving through the seal across your face or eyes, then readjust the fit of your respirator and check the seal again. A proper seal of your respirator prevents air from leaking between the face and the face seal. If you cannot achieve a proper seal, you are not protected and should not enter a hazardous area. N95s come in different forms, varying by the manufacturer and brand. All N95s are tested and certified by the National Institute of Occupational Safety and Health and filter at least 95% of airborne particles, but are not resistant to oil. Surgical N95s are also approved as a surgical mask by the Food and Drug Administration. You might be issued an N95 that is different from what you normally use due to supply issues. You may not be fit tested for your new mask, but you should always do a user seal check for yourself.
I think that information is great. So regardless of your fit test, whether you had that done in the very beginning from your facility, it's important to check every time you wear your N95. And if you are doing the self-seal check on yourself and you have complications, you should report this to your manager and not be working where there's flour dust until that is resolved. That's my presentation. I think it's important that we keep our lungs healthy, and I was excited to look into this a little bit deeper. I provided, let me get this video. I provided a pamphlet that you guys all should get, or it's a flyer, Flour Mill Workers' Risk for Respiratory Disease. Statistically, without correctly fitting PPE, like their N95s, 1 in 10 flour mill workers will develop occupational asthma. This again, this should be working in conjunction with ventilation that's in your facility in the building, but 1 in 10, that's pretty high chance. Recovery. So if left untreated, 30% of this population has shown to have long-term pulmonary deficit, which can or cannot increase with age and turn into a chronic problem. I've provided a few resources. OSHA, Utah Department of Health has an asthma program, and they have great resources. The CDC gives some information on occupational asthma. And I found Intermountain Allergy and Asthma. This is a facility of doctors, and they can help with treatment if you have already gotten the occupational asthma. And that is it. I appreciate you guys, and thank you for your time.